You know, back in the day, back in the early 90s, I was the chair of the healthcare work group for the Socialist Party. Uh, I even went to Chicago and Milwaukee for the national convention. And in Milwaukee, I was asked to speak about healthcare with Don Dumakis to the national committee asked me to talk in the Socialist Party. And so in the Wisconsin room, the Hotel Wisconsin, I met Frank Zeidler, the mayor of Milwaukee, 3 times. Sewer socialist. You can look him up on Wikipedia. Great guy. Corresponded for years. Very proud of that. But this was back when Hillary Clinton was pushing for health insurance reform, national health care system. There were tons of legislative plans out there from Marty Russo, Wellstone. Everybody had a health insurance plan because we were all so sure that we were going to get a national universal health care system for everyone. As it turned out, that didn't happen. If anybody remembers Harry and Louise, the ads run by the pharmaceutical companies and health insurance companies, health insurance companies. It was a time when we really thought we were going to get some really significant change for health and get health care to everyone. It didn't happen that way. When I went to the Socialist Party convention in Milwaukee, my plan, my idea was, as the chair of the healthcare work group, was to focus on a specific piece of legislation, in this case Marty Russo's legislation, the calling for a national healthcare system, instead of, abstract. I was trying to be constructivist as a socialist instead of just, always in the abstract. So Frank Zeidler helped me out on that, and I believe Quinn Brisbane was there. Ann Rosenhaft, I remember talking to her. She was a hell of a woman. Carrie Fisher, the whole bunch. But here we are in 2011. There's no way in hell we're going to get a national healthcare system. No fucking way. I just got in the mail today. This is my formulary. I'm supposed to look through and see what drugs are covered, if my drugs are covered, how much they'll cost, which is pretty significant, what they won't cover. And it's just page after page of this nonsense. All you have to do is cover everyone with a national healthcare system, and you wouldn't have to print these formularies that every insurance company has. I get my insurance from, obviously, from disability, and Mass Health. So it's pretty low cost for me. But if you're lower middle class, and if you're not on disability, you're fucked in this healthcare system. You'd be lucky if you can afford catastrophic health insurance. 50% of the people in this that are declaring bankruptcy because of healthcare costs. It's rising faster than the rate of inflation, price of the cost of healthcare. Yet profits are higher than they ever were for pharmaceutical companies, who are allowed to run ads on television, which I think is wrong, and also insurance companies are also just making money coming out their ass. So it's wrong for people to profit, I think, off of this. We had a national healthcare system set up independently from the government, and you could be run at cost, and also let Medicaid, Medicare let the government buy drugs in bulk. Who could be against such a thing? Well, Republicans are against it because, they're whores. And I don't mean that to be nasty to whores. Republicans are just, most Democrats too, just lowlifes. So that's it. All this wasted paperwork formularies, all of this bureaucracy in a supposedly efficient private system is nonsense. Most efficient system would be a single payer system on the model of, well, you pick it, Canada, Finland, Sweden, the National Health Service of Britain, France, Germany, which I like, the sickness funds. But the Canadian system works fine by me. Every other industrialized nation in the world has a national healthcare system that covers everybody. In the United States, fewer people are covered now than ever before, and people who are underinsured, that is, they only have catastrophic health insurance, is pushing ever higher. It's an unbelievable stress on people who are already ill, physically or mentally, to have to deal with this nonsense, to have to deal with a healthcare system that tries to profit off of people who are suffering. And the healthcare system in this country, the way it operates is the government takes care of the sickest and the oldest, people who aren't working. People who are working, people who are younger, and people who are not sick, generally speaking, are covered by private insurance companies. And that's interesting, that they can barely make a profit, or they can make a profit only by having the least sick, youngest working people. If it wasn't for the government and all those people were dumped on the private insurance, all those elderly, disabled people, poor people, you can see why the for-profit system does not work when it comes to healthcare. It doesn't work when it comes to a lot of things, but I'm a socialist. But I think not a lot of non-socialists would agree that this healthcare system needs to be changed. This doesn't work for profit health insurance. Having 100 different insurance companies and plans just doesn't, it's not a good idea. If it wasn't for Mass Health, I would have to look through these books that they sent me. And I would have to find, look at this one, I'd have to find a formulary that covers my drugs. And it's just so, well, let's put it this way, it's not a efficient plan. Government would be far more efficient and far better. And that's all I have to say about that today. So I'm going to light my pipe. This kid's outside making a lot of noise. And I'm going to go, shut them up. Yeah. You can see the cat in the back on the table. We love our cats here. Have a nice Saturday. Get laid tonight. Over and out.